Good morning, and we're ready to jump into today's topic, which is looking at original Medicare Parts A and B, and so that we can get a greater understanding of just what's covered and just how that works. My experience has been that the more we know about A and B, the easier that sale becomes, because A and B are so packed with liability that it's just so easy to include, explaining how it works. And as we go in and show that to our customers, we find that they just want to get something to help protect themselves, because you can literally go bankrupt if A and B is your only source of medical insurance. So with that said, let's just kind of jump into that. So I'm sure we have all seen this before. This is, the way the Medicare choices work. Today, what we're talking about is the original Medicare, or what I like to refer to as Medicare out of the box, right? It's just the way that it comes from the government. And remember that when one turns 65 and is no longer participating in an employer group plan, Medicare is all that there is. You can't, once you're eligible, go and get another plan. You can't go to a carrier and buy a major medical plan. If you qualify for Medicare, you cannot use the ACA any longer, because that's one of their questions. You're pretty much going to be limited to what's covered by A and B. So with that said, let's see exactly what Part A covers. You can get the whole slide up here. And one of the things that I truly like to stress when we talk about Part A is the inpatient aspect. So you see inpatient hospital care, inpatient care in a skilled nursing facility, and there's home health care and hospice care. But first we're going to talk about that inpatient hospital care. So hospital Part A covers inpatient hospital care when all of these things are true. You're admitted to the hospital as an inpatient on an official doctor's order, which says you need inpatient care to treat your illness or injury, and that hospital accepts Medicare. Now, what are you going to get? Well, it's going to be a semi-private room, any meals that you need while you're in the hospital, any general nursing that you need while you're in the hospital, any drugs that are required as part of your inpatient treatment. And they always throw in that caveat of other hospital services and supplies. Remember that all of that must be directed toward helping you as a patient. The way that I always kind of point out to people is like, if there is a television in the room and a telephone in the room, and that showed up on the bill as a separate line item, Medicare wouldn't pay for that, because that has nothing to do with your hospital care. So the way that it works is you pay a deductible. So you're admitted to the hospital, and that means your portion of that payment is going to be $1,556 deductible for the benefit period. Notice that is not an annual deductible. It is a benefit period deductible. I'm going to break down that benefit period for you a little bit more here in a moment, but for now, just know that that benefit period, that $1,556 covers you for 1 to 60 days in the hospital. Excuse me. So 1 day in the hospital or 60 days in the hospital, your deductible is that $1,556. Now on day 61, you pick up coinsurance on a per day. So from day 61 to day 90, there's $389 coinsurance that the patient will pay. And if they're there beyond 90 days, that copayment goes up to $778 per day. Now, Medicare is really only going to cover you for a stretch in the hospital of 150 days. And they would only do that once. Okay? And because from day 90 to 150, you're using the 60 days that are known as your lifetime reserve. So the first time you stayed 150 days, you would have used up those lifetime reserve. After that, you only have 90 days that you could spend in the hospital at a time. And again, 1,556 would cover you for the first 60, and then $389 per day through up to day 90. So that extra 60 days is what they call the lifetime reserve, and once you've used that up, it's gone. And any time spent beyond your lifetime reserve days, the individual will bear all the cost of the hospitalization. That's why I was saying there is a lot of liability associated with Medicare Part A. Now, if that hospital is a mental hospital, the rules are going to be just a little bit different. The day 1 through 60 stays the same, 61 to 90 stays the same, and if you get into you have your reserve days, those are all remaining the same, and the co-payments stay the same. The big difference is we have a 190-day lifetime limit on psychiatric hospital stays. So you can see that after 190 days, you're not even eligible to go back to the mental hospital. So one of the little strange things that fits in there about Medicare, though, is that if you got your psychiatric care at a general hospital vice a psychiatric hospital, that 190-day limit does not apply. I mean, all the other co-payments and stuff still would, but you would still be able to get your time in there. And then also with a mental hospital, all that care that you received, if it's outside of the hospital, you're going to, or I shouldn't say outside, but the approved amount of mental health services you get from doctors and providers while you're in the hospital inpatient, you'll pay 20% of that cost. So that's your inpatient in the hospital. The next one we're going to look at is the inpatient in a skilled nursing facility. So I always like to hit you with a rhetorical question. What is a skilled nursing facility? Well, the short answer is it's not a nursing home. So Medicare does not cover nursing home care, but it does cover care in a skilled nursing facility. And that skilled nursing facility could be housed in a nursing home or in a hospital, or it could even be freestanding. So we call it a skilled nursing facility, and the significant attribute there is the kind of care provided. A skilled nursing facility is going to provide medically necessary nursing and or rehabilitation services. In some areas, you'll actually see it not labeled skilled nursing, but actually rehabilitation. Okay, it'll be a rehab hospital or something like that. And don't confuse that with, drug treatment or alcohol treatment. When we say rehab, we're talking speech or occupational or physical therapies, those kinds of rehab is what we're talking about. Now, in order to receive Medicare coverage for your skilled nursing stay, again, your physician is going to have to certify that you require the daily skilled care that can only be provided as an inpatient in the skilled nursing facility. And this is the rule that really hurts people. It says the beneficiary must have been an inpatient in a hospital for at least 3 consecutive days for the same illness or condition before being admitted to the skilled nursing facility. Okay? So you can't just decide that you need even though you need the level of care required by the skilled nursing facility, you can't simply decide that and go to one. Okay? You had to have that 3 days in a hospital, and those, again, consecutive. And if I give you this scenario, you wouldn't qualify. You went to the hospital. You were held for observation. At the end of that first day, 24 hours of observation, they admitted you to the hospital. And then you spent 2 days in the hospital and they wanted to discharge you. You would be going home because you did not have 3 inpatient days in the hospital. So things like observation or things like the emergency room, those are not admitted to the hospital. You may have been there, and you may have spent a day or two even there, but that was not admitted to the hospital. Now, there is a little caveat that says that you could go to the skilled nursing facility within 30 days of just discharge from the hospital, and that would have been you had your 3 days, but you decided to go home instead of the skilled nursing facility, even though you should have gone there. They give you 30 days to go to the skilled nursing facility, so you could still go there. Okay, and of course, the facility has to be unapproved, Medicare approved. And again, you're going to get that semi-private room, you're going to get meals, but now you're going to get rehab services, and you're also going to get your prescription drugs that were administered to you while you're in the facility. Cost. Medicare will cover at 0 cost the first 20 days in the skilled nursing facility. So that's a $0 copay. So basically, you paid your deductible, you went to the skilled nursing hospital, you spent your 3 days. Now you're in the inpatient skilled nursing facility. So your day 1 through 20 in the skilled nursing facility is 0 cost. On day 21 through 100, so 21 to 100 is $194.50 a day for your benefit period while you're in the skilled nursing facility. If your stay there goes beyond 100 days, on day 101, Medicare doesn't cover the skilled nursing facility, and the individual is responsible for all cost for any time spent at day 101 and beyond. So we see there home health care. So home health care, you didn't make the 3 days, but you still needed some level of care, or perhaps you needed physical therapy or speech pathology, occupational therapy, something like that. Well, what you would do at that point, you're going to be covered for this intermittent, skilled nursing care in your home. Okay? So you can get, medical social services, part-time or intermittent health aid, for personal hands-on care. But you're usually going to be using a home health agency to coordinate the services that your doctor has ordered for you. Okay? So to get the home health care, your doctor is going to put together a plan. Okay? Because in order to get it, the beneficiary must have their physician certify that they need the medically necessary care and has an approved treatment plan for these services that are going to be provided in your home. Now, just to make sure that you are aware, Medicare doesn't pay for 24-hour care at home. It doesn't pay for meals being delivered or homemaker services or any kind of personal care. That would be at your own expense. They're just going to cover that medical stuff. And it could be, so any kind of, maybe you need your bandages changed or something like that. But typically it's going to be physical therapy of some sort. And they're going to come to your home and provide that care. And it is covered at zero copay for that home health care. Now, if you do need something like a wheelchair or hospital bed or something like that, that would fall under what they call durable medical equipment, that you're going to be subject to the 20% copay. Medicare, again, under that is what you're going to find that is falling under Part B. Part B is 80/20. So if you do need those kinds of things, Part A isn't covering. Part B is, and that has a copay. Now, last item on that list is hospice care. So hospice care is for the terminally ill. Right? Hospital is covered by Part A and has comprehensive coverage. It can be at home, can be in a facility where you live, but it is symptom management and pain control only. Any effort to, cure the patient, that all stops. If somebody had, a cancer and was getting chemo, and it was determined that you're terminally ill, they're not going to continue with the chemo or the radiation treatment. It's strictly now going to be pain control and just keeping you comfortable in your final days there. So there can be a lot of counseling going on. Nursing care and your prescriptions. On your prescriptions, you can get a $5 copayment for each prescription drug. But again, we're really looking at pain relief and symptom control. Okay. And your doctor is the one that has to, order. Or approve you being certified, I should say, that you're terminally ill and you have a life expectancy of 6 months or less. Now, if you're still alive at that 6-month point, that doesn't mean that it's all over. They would just have to, re-examine. It has to be a face-to-face meeting and really determine that you're terminally ill. I've actually known a person that they thought was terminally ill and wound up being discharged and went home. So let's look at the cost associated with Part A. So typically, we don't pay a premium for that. Okay? For most of us, we have paid for Part A through our taxes. Okay? If you're a W-2 employee, I'm sure that you've seen on your pay stub, Medicare taxes going out. And definitely if you're a 1099 employee, when you did your estimated taxes, you saw that money going off to Medicare. Typically, I think it's about 15% between Social Security and Medicare that you'd be paying off. Now, those who have to have not paid Medicare taxes, for 40 quarters or 10 years, same as for Social Security, right? You had to have done your, put your money in. They do have, for those a little partial in there, if you've done at least 30 quarters, but less than 40, they'll charge you $274 for Part A. But if you didn't meet the at least 30 quarters, it's literally $500 a month. Okay? And like I said, there's the deductible, that $1,556 for the benefit period. So now let's talk about the benefit period. Okay, it begins the day that you are admitted to the hospital. Again, inpatient, you're admitted, you're in the hospital. So it begins when you're admitted to the hospital, and it can continue on through the skilled nursing facility, and ends when you haven't gotten any inpatient hospital care or that skilled nursing facility care for 60 days in a row. Okay, so just kind of keep that in mind. So I've been finally discharged and sent home, whether it was the hospital or the skilled nursing facility, and I haven't been readmitted, gone back for the same problem. Okay? And to been the same problem. If it's a new problem, it's a new benefit period. But once my 60 days have gone by, if I were to be readmitted to the hospital for that same thing, if it's something new, obviously it's a new benefit period. But if it was the same thing, but I'd been home for 60 days after discharge, I would be paying the deductible again, because that's, like I said, it's not an annual deductible, it's a benefit period deductible. And if you're the world's most unlucky person, you could pay that 6 times in 1 year. So that is one of the big liabilities with Medicare, and specifically with Part A. Okay? And we talked about that what it got you was the 60 days. Okay? And then the breakdown after that was co-payments. All right, so let's move on to Part B of Medicare. So here's the things that Part B covers. Okay. All right, so I always like to point out, when it comes to getting a doctor, because we see the first thing there on the list is your doctor. So when it comes to doctors, they did a survey, and they found that about 98%, and we're talking primary care doctors, that are non-pediatric. Pediatric doctors typically don't take Medicare because a pediatrician is not going to deal with Medicare patients, right? So 98% of the non-pediatric primary care doctors accept Medicare. Don't have a figure for specialists, but I'm sure it's probably pretty close, because not a whole lot of money in primary care these days, and most of the doctors go off to be specialists pretty quickly. So Part B covers 2 types of services. We have things that we call medically necessary services. And these are the services or supplies that are needed to diagnose or treat your medical condition or conditions. And of course, those things, the treatment has to meet accepted standards of medical practice. So that's where we see our doctor visits, ambulance services, x-rays, lab tests, all those kinds of things. You can even get some of your drugs covered under Part B. Now, when we talk about drugs, we normally associate that with Part D, as in Delta, but there are drugs covered under Part B, as in Bravo. Here's the big dividing line, and if you just keep this kind of clear in your mind, you won't have a problem. If I go to the doctor and the doctor writes me a prescription and I take that prescription to the pharmacy to fill, that falls under Part D as in Delta. If I have to go and have a drug administered by the doctor in a hospital or doctor's office setting, that will most likely fall under Part B. I'll give you some examples. You need chemotherapy, and they want to do an infusion. So you go in, and they have they set up an IV and a drip, and you get the medication done over a period of time through an IV. That's going to be Part B here. You go to the doctor's office. And I'll give you the example of my sister-in-law goes in and she gets a cortisone shot in her knee from time to time. Okay, you can't get that prescription from the doctor and go to the pharmacy and fill the prescription. That's done in the office, so that's going to fall under Part B. So that's kind of the dividing line. Are you given a script and go to the pharmacy, or do you have to go to the hospital or doctor to have it administered? The other side of Part B is preventative services. So think of healthcare to prevent illness, like flu shots and COVID shots, and or getting any of these cancer screenings. There's a long list of cancer screenings that are covered by Medicare, so that they can detect things at an early stage when a treatment is most likely to work. And I want you to be cautious with this. Think of like the one that comes up a lot that people talk about is the colonoscopy. If the time period on a colonoscopy is every 10 years, you probably start in your late 40s, early 50s, I forget where it begins, but now you're into Medicare, and the interval is 10 years, and you go in, and let's just use an example where you go in, you get you're having your colonoscopy done, and they find some polyps this time. And so the doctor removes the polyps, because they'll do that as part of the preventative measure, the screening test. They'll do that. But at the end of that, the doctor says, I want you to come back next year, and we want to do another colonoscopy to make sure that there's no polyps. Okay, well, your coding on those colonoscopy just went from a preventative to a diagnostic. So on that next one, when you go in a year, that was no longer a preventative, it's now diagnostic. And you can be charged for that under Part B. Okay? So just make sure people understand that. And not every possible screening test you can conceive of is covered under Part B as a preventative service, because all the preventative services are done at zero cost. It's going to be your annual wellness check, and then a whole series of screenings that are included in there. Okay, so think about what being there, because usually I would say that if you're asked if this test is covered, you may have to go and check on Medicare's website to see if it's a preventative one, or is it one that'll have a $20, or not $20, but a 20% copayment with it. Okay, so let's look at the cost. Now, let's kind of look at this in two parts here. The first is the premium. Part B has an income-based premium, and it can range from $170.10 to $578.30. I'll show you the chart in a bit here, but most people are going to be paying that $170. That's just pretty much about what the cost is. Unless somebody's really making more than, a joint return of more than $180,000 a year, will kick you up into a higher bracket it, but I'll show you the table in a bit. As an annual deductible, the current annual deductible is $233. So each year, starting in January, it resets from the previous year. It can go up. I mean, that's just the current amount. And because it adjusts for inflation and all that each year. So we'll see, probably next year it'll be pretty hefty. You'll see probably a pretty good increase. But it does change annually. And after the deductible, the insurer it's an 80-20 split. But here's the kicker. And this is, again, going back to that liability we talked about. So and I always like to use this example with my customer. Medicare has two terms that they use. So for every code out there, I mean, there's a billing code for every procedure that Medicare accepts. So I'm just going to make this up as we go through here. We're just going to say that a PCP visit, primary care physician visit, their code is $100. That's what they say the value of that visit is. So if I go and I see the doctor, I would expect that they would bill Medicare $80 and I would have a $20 copayment, and they're going to collect at the time of service. So likewise, if I have a surgery and that surgery is $100,000, I should expect a $20,000 cost share, my 20%, and again, do at time of service. And that's what the hospital is expecting, unless you make some arrangement ahead of time. So that's why I was trying to drive home this concept of no maximum out of pocket. Okay. Now, one of the other things that's done by Medicare is, like it says, we have two terms. We have accepts Medicare, and so many doctors accept Medicare. And then we have accepts Medicare assignment. If the doctor accepts Medicare assignment, what they're agreeing to is whatever that code assigned to that procedure is, that is what they will accept as payment in full for their services. Okay? So in the case of the doctor visit, they would have got 80 from my claimed, the Medicare claim, and 20 from me. Now, doctors are given some latitude. They can accept Medicare, but not accept Medicare assignment. And if they just accept the Medicare, but not the assignment, what happens then is they're allowed to charge up to 15% more. That's a balanced billing of 15%. But what happens is, and this is a simplified version, is that Medicare says, okay, well, we approve that procedure for $100 and we pay 80% of the $100. Well, your doctor charged $115. So I would have to pay my 20% plus the 15%. So my bill would be $35 for that same service if the doctor accepted Medicare but not Medicare assignment and charged me the full 15% allowable. Okay. So just keep that in mind to be able to explain that. These are all reasons why people want something to supplement their Medicare. Now, as far as paying for your Medicare, your premium, you can do it as an automatic deduction from Social Security or your railroad retirement pension. For those who have a federal government pension, it can come from there. Or if you want to just do it from your own checking account because you're not on Social Security yet, you can, but then they're going to want a quarterly payment. So they'll do it quarterly. All right, so let's see here as we move on. Here's that chart. You will hear this, you'll see this in a couple of different places. Come on here. Okay. This is also known as IRMA, or Income Related Monthly Adjustment. Right? You don't really hear that used with the Part D, like drug plans. However, with Part B, they just show you this table. But the same table and the same amounts will go with the IRMA also. Okay. So if you're still making over $500,000 in your retirement, you're going to pay $578. But here's what I would really like to call your attention to. This particular chart is the current one, and it says if your yearly income in 2020, this is what you would be paying in 2022. So what we're trying to say is there's a 2-year look back. So when a person started their Medicare this year, when they were determining what that Part B premium was, they would be looking at their 2020 tax return. So maybe they were making big bucks back in 2020, and so they wind up with one of these adjustments that charges them more. Well, the good news is that it will go away. It will eventually adjust. Okay. So just think of it that way. What's going to happen? What I've seen happen a couple of times is, in one instance, somebody sold some property and was unable to, do the exchange or anything, and so they wound up having to pay taxes on the earnings that year, and it really bumped up their income. But that was only a 1-year apparition. That's not their normal. So until it caught up, that 2-year look back got them, and then they returned to a normal 170. And the other one was somebody who retired early, took a large severance, and that severance went into their income when they filed their taxes, and it gave them the big number. In both those cases, it went, it only lasted for a year or two. Okay, Medicare has a late enrollment penalty for Part B, and then the late enrollment penalty is 10%. Now the thing is it has to be a full 12-month period. Okay, they don't do it for just you were late, but it was less than 12 months. Okay, so let's come on, computer. So if you went, for 11 months or fewer, there is no penalty, and there's no penalty if you sign up during a special enrollment period. And so, but if you miss all of that, you don't get your special enrollment period, or you miss that, your customer can then go for the general enrollment penalty. And that's every year. Our general enrollment is 1 January to March 31st every year. And for coverage that will begin in July. Well, here's the thing. If you missed your enrollment and then you went and did the general enrollment, if that pushed you over a year without insurance, that 10% penalty will apply and get you. Okay. Now, when it comes to the special enrollment, I don't think I can truly emphasize this enough. There is only one special enrollment for enrolling in Medicare itself. When it comes to Medicare Advantage plans and drug plans and those things, they all have. I mean, there's literally a book published by United Healthcare that gives you that's about 56 pages that explains all the SEPs for enrolling in drug plans and enrolling in Advantage plans. So I want you to be sure, though, because your customer will definitely confuse enrolling in Medicare with enrolling in Medicare Advantage or drug plans. I want you to make sure that you never confuse enrolling in Part B. It has one SEP, and that only SEP is loss of employer group coverage. Okay? That's the only SEP for enrolling in Medicare. And it's an 8-month SEP, 8 months from when you lost your group coverage. So most people should have no excuse for missing that. But those that do, 1 January to 31 March is the general enrollment period. Okay, let's talk about some things that Part B does not cover. And I'll just put up the list here, and we're going to kind of talk about these because it doesn't cover things like private duty nursing, skilled nursing over 100 days, intermittent nursing home care, physician's charges above the approved amount, outpatient prescription drugs, care received outside of the United States, custodial care received in the home, dental care. But when we talk about dental, we're really talking about that stuff like routine checkups and fillings and extractions and dentures, that kind of stuff. Okay, if you were to, I always use the example in an automobile accident, you wound up, smashing your face against the steering wheel and knocking out and doing some damage there, that would be covered because that's part of your medical coverage. But what's not covered is any of that routine kind of stuff. Some things on this list, it's a government program, so know that there's always exceptions. I gave you the one for dental care. See, eye exams related to contacts and glasses prescriptions. Well, again, all your routine eye stuff is not covered. But if you needed glasses following cataract surgery, that's covered. Okay. We talked about dentures, cosmetic surgery. Again, we're talking about discretionary stuff here, where you wanted to have it done. If you needed cosmetic surgery due to burns, right? Burn, they would do that. That's covered under Medicare, even though it's cosmetic. Acupuncture. While they say that acupuncture is not covered, but if you dive into that a bit, you'll find that acupuncture for lower back pain is covered. But my point with that is if that is the only thing the acupuncture doctors are allowed to bill for, one small procedure that they can do, good luck finding one that's signed up and willing to accept Medicare. Hearing aids and exams for hearing, not covered. Cochlear implants, covered. Yeah, I don't know what the distinction between those are, but they've made one. Long-term care is definitely not covered, and I don't know of any exceptions to that. Well, we say concierge care, what they really mean is the fee. Okay, if that doctor accepted Medicare, well, then they'd be good. So just keep those things in mind. All right, let's talk about enrolling. Okay, if you're still working and you're covered by that group health plan, you don't need to enroll in Medicare Part B at age 65. And when that health plan ends, again, you have 8 months in order to sign up for Medicare. Just like to point out, that is the only Medicare SEP. Just remember that. As far as how to go about enrolling, if you're 65 and you're already receiving Social Security or Railroad retirement benefits, that card will simply show up in the mail. Okay, it'll about 3 months prior to your birth date month. Okay, the card will show up. I want you to know that Medicare always starts on the first day of the month. And if the month that you turn 65 is when you're signing up, it would start on the first day of the month you turn 65, with one exception. If your birthday was the first of the month, you were born on the first, it'll be the first of the preceding month. But if you're drawing Social Security already, Medicare knows all of that. And about 3 months prior to your birth date or your enrollment date, the card will show up in the mail so you can start making plans. If you are under 65 but you're on disability, okay, at the 24th month, they're going to shift you, on the 25th month, you're going to be shifted over to Medicare. It'll start on the first day of the 25th month. And again, about 3 months prior to that, you're going to get that card in the mail. Now, if you're turning 65, you're not on Social Security, you're going to need to contact Social Security 3 months before your birthday month. Don't try to do it any earlier than that. They won't talk to you. Okay? 3 ways to go about it. You can visit the local office, plan on spending about a half day, either a morning or an afternoon down there trying to get that taken care of. You can call them on the phone. Okay? They'll do everything with you over the phone. Again, plan on about an hour of hold before you're able to speak to anybody, but you will. It takes about an hour, and you can talk to them. My recommendation is to go online to ssa.gov and enroll there. Take you about 15 minutes. Do it from the comfort of your own home. If you needed, your time passed, you met some of these other ones, you knew that it had started because you already were receiving Social Security, or you signed up online, or you went to the office and signed up and all that, you can call them up and get your numbers. And then for all of this information, if you're a railroad retiree, so you have to contact the Railroad Retirement Board instead of Social Security. So here's what happens. At this point, you have to have gotten your original Medicare. If you want to go to a Medicare Advantage plan, that's great, but you still have to have A and B. Getting a Medicare Advantage does not mean I can stop paying for my A and B if I had to pay for A, or stop paying my premium for B. Okay, must continue my A and B, and they have to remain valid in order for my Medicare Advantage. If I want to continue on down the left side here, you can get a standalone prescription drug plan. Not a requirement. We'll see next month when we talk about prescription drug plans. There's a penalty for not enrolling, but there's nothing to force you to enroll. And if you want to fill in those gaps and protect yourself against all that liability I talked about, a Medigap plan would do that. Okay. The other choice was to go to Medicare Advantage. Everything that's covered from Part B and A and B is included in Part C. Okay. That's usually going to include your prescription drug coverage, and that's the end of it. You can't get a Medigap to pay the co-pays of your Medicare Advantage. Okay.